Hi, I'm Scott Levy, Chief Medical Officer at Doylestown Hospital. Here once again to talk about COVID, specifically the vaccine and variants, which has been on most people's mind. We've got a lot of questions sets in the last week or two about these variants. As we spoke about last week, there's a real urgency for everybody to get vaccinated as soon as you're eligible. And as everybody here should be well aware, by the middle of April, April 19th, every individual over the age of 16 will be eligible for a vaccine in this state. And there should be lots of opportunities for people to get vaccinated as well. The reason we're in a race is because what variants do better than anything is vary. And early on, the vaccine was well developed to not only kill some of the initial forms of the virus, but also some of the variants. As of today, all of the variants you hear about that get us real nervous are still very effectively not able to grow in the setting of having any one of the vaccines that are now available. However, with time, if those variants get to change to continue to evolve, the risk is that down the road, 3, 6, 9 months, some of those variants may be so different from the initial virus that the vaccines that we have available won't be able to be effective against those. And that's what everybody's talked about, is the need to maybe modify those viruses, those vaccines down the road, just like it's done with the flu every year. Every year, the flu viruses mutate so much that a new vaccine is needed. Fortunately, the virus so far has mutated and varies quite a bit. However, the initial vaccines are effectively 100% protective against serious disease and death. And as a matter of fact, Pfizer just finished a study where it was 100% effective against kids getting sick at all. There's really no significant clinical difference between the three vaccines now available in the United States. Moderna and Pfizer is almost identical drugs. J&J uses a different technology, and it's one dose. However, when it comes to serious disease, hospitalizations, and death, they all do the same thing. And that's a nearly 100% effective against people dying if you were to get infected. There's a small percentage of people who might get the virus, may even have some mild symptoms, but they won't progress to more serious disease. For folks who don't want to get vaccinated because they're concerned about the side effects of the vaccine, speak to anybody you know who's had the actual virus, and there is no question about the impact of the virus versus the vaccine. Most importantly, the number of long haulers, those people we've seen who have long-term sequelae from this, loss of taste, muscle weakness, fatigue, is really significant. And to have a short-term acute disease wind up with a long-term problem is something we all need to avoid. Get the vaccines. As far as getting together in a small group where everybody's vaccinated, the chance of one person having the virus despite being vaccinated is extremely low. The chance of that person then spreading it to somebody else is effectively zero. So if you're in a group of people, 6 or 8 people in a private setting, everybody's vaccinated, don't use a mask. And I'm not even sure that social distancing should be done unless you're looking for an excuse to stay away from people. However, when you're in a group with people who aren't vaccinated, the CDC guidelines are pretty clear. It's okay to do so as long as it's only one person who's not vaccinated, and that person has to be at low risk. Because if that person were to get infected, it could be very bad. The chances, again, are low. However, commingling multiple people from multiple families or multiple pods, where there's more than one person who's not vaccinated, we're right back where we started from. And that's exactly why we've seen the recent surge. Because people are getting vaccinated and not waiting the 2 weeks after the second dose because they're partial protection, or they're in a mixed group with some people vaccinated and they think that's safe. And if you do the calculus and the math, that's not safe enough. And that's why we're seeing the ramp up we're seeing now. So we're real close. There's no doubt that the number of cases we see would be exponentially greater than they are if it wasn't for the vaccine. So let's let the vaccine what it does best and let it do that and protect people from spreading disease, because by the end of May, where vaccines are readily available in the state, we should see dramatic improvement. So we're there, get vaccinated, and then go back to living. Be well, everybody. See you next week. Have a great holiday.